I have insurance and still can't pay my medical bills. There is no cost transparency in healthcare in this country. So let me explain. My deductible is $7,900 for the year. My copay is $20 per visit. And the copay does not count towards my deductible. That means that I have out-of-pocket costs of at least $7,900 before my insurance pays a single cent. On top of that, I'm also paying a monthly premium which averages $883 a month. I am told what doctor I can use, in which network, and who I must see. Also, my insurance tells me how I am to be treated and what medication I will be allowed. By the time I pay the $7,900 deductible for the year and the monthly premiums, $883 times 12 months, I have paid a total of $18,500. I also pay all dental out of pocket, another $379. Now, during this time, I'm not afraid to go to the doctor because of needles and blood. I am afraid of the medical bill and the choices I will have to make at the end of the month. House payment or medical bills. Even more bizarre, I am a customer of the insurance company. I buy the insurance service, and without me, the insurer does not get paid. The insurance company is taking away my right to choose who I see for healthcare services. And I still write them a check every month. I am blindly paying into a system for years and years. Let's say I work 25 years and pay into that system $18,850 times 25 years. That's about $472,000. That could have been a beautiful beach house. Of course, we get sick and money is taken from that pool of $471,700, yet we continue to be so fearful. Do you know that spending a night in a hospital is a rare event? 92% of the population did not spend one night in a hospital, and only 1% spent 8 or more nights. According to a report released by the U.S. Census Bureau, the average American had 3.9 visits to doctors, nurses, or other medical providers. When you buy a house, you are not told where to live, how to live, and what repair person you may see. What insurers do to us is reprehensible. That means it's very bad. We, the people, need to take back control of our health care. We, the customer, need to say we are not satisfied with the quality of services. We, the people, want more choices because we're fearful that we're going to be left sick and stranded even as we continue to pay. Yet, because we, the people, just don't understand the healthcare and insurance systems, we don't assert our rights. So what are the next steps? Start asking your doctor or hospital what the costs are for your treatment. I travel the globe, and in every country there's a list of all the services and procedures with a coordinating price list. Demand to know what your healthcare cost is. Ask how much do they, as the hospital, get paid by the insurance company so you know how much you have to pay yourself. Only the 6 major insurance companies that dominate the USA dictate how much you pay and who you see. The insurance company is telling the hospitals how much they will pay them. We fight for our freedom of speech. We fight for our right to bear arms. We speak up about inequality, but we the people say nothing about our personal health care and who should take care of us when we are sick. Our politicians have direct control over what insurance companies can charge us. They have a duty to the people. The law gives authority to the director of insurance in each state, an elected position, and the government in general to set rates for how much we pay for insurance. What exactly do I want from my politician and my employer? I want transparent pricing on my healthcare costs and to know exactly how much I am paying for each of my healthcare procedures. As a patient, I do not want any cost sharing. I do not want to pay a deductible, copay, or coinsurance, which means you will pay a percentage, which generally applies to the hospital stay. You may have to pay up to 30% of your bill. I want an open network where I can go to any provider or hospital. I want choices. My choice, my body, and who I want to take care of my medical problems, whether that's in my state or outside my state or even outside of my country. We the people demand one unique policy for covering essential healthcare benefits. Why is there a need for a hodgepodge of different policies that pay different amounts? Insurance actually pays different amounts for the same treatment to different hospitals. Your politicians can change this. Your employer can negotiate with politicians and insurers. Providers can negotiate with your hospital to get a better deal. You can actually shop your healthcare to get the best pricing. Proceed as if you were buying a car. Once you have control, you control your treatment. If you do not have control, your insurance company controls your treatment. Of all the different types of insurance, only health insurance dictates your life in this way. So you're thinking that is too difficult of a task? My answer is, please, just do your part and ask the question, what is the price of my healthcare procedure? I demand to know because I cannot afford any surprise bills. There is no hospital or healthcare price transparency in the United States. That needs to be fixed. Remember, the most powerful entity in the United States is we the people. Hope you enjoyed this video. If you want to hear more videos on this and other healthcare related topics, please press the subscribe button. Please press the bell to receive updates whenever we post a new video.